Meningitis. In this video, we will learn about what is meningitis, causes, clinical features, that is signs and symptoms, investigations, and treatment. So let's start it. What is meningitis? It is inflammation of meninges in brain and spinal cord due to infection, most commonly due to bacterial infection. It can also be due to viral or fungal infection. Acute bacterial meningitis. Causes: Streptococcus pneumonia in 50% of the cases, Neisseria meningitis 25% of cases, Group B streptococci, L monocytogenes, H influenza. Clinical features: Classical triad consists of fever, headache, and nuchal rigidity. What is nuchal rigidity? Nuchal rigidity is inability to flex the neck forward due to rigidity of neck muscles, as seen in the figure. It is very important sign in diagnosis of meningitis. Other clinical features include consciousness is vary from lethargy to coma. Nausea, vomiting, and photophobia are common. Seizures and convulsions may be seen. Signs: Chronic signs. There is pain in the knees on flexion of the hip, as you can see in this picture. Brudzinski's sign. There is flexion of the hip or knees on flexion of the neck. As you can see in this picture, when there is neck is flexed, there is flexion of knees also. And neck rigidity, as seen before, are the classical signs of meningitis. Other signs, such as signs due to cranial nerve palsies, that is visual field defects, dysphasia, and hemiparesis. Meningococcal rashes on trunk, lower limbs, mucous membranes, conjunctiva. Papal edema is also seen. Reduced level of consciousness. Raised ICP, intracranial pressure. Investigations done in meningitis. First is CSF examination. CSF is taken by lumbar puncture. On microscopic examination of CSF, in bacterial meningitis, the appearance of CSF is turbid. The pressure, CSF pressure, is elevated. WBC count is between 1000 to 2000 cells. Proteins are also raised, that is more than 200. Glucose is reduced to less than 40. Other examinations, that is in viral meningitis and fungal meningitis, is also given in the picture. Blood culture is also done for starting proper antibiotic therapy. Treatment: Due to emergence of penicillin and cephalosporin-resistant Streptococcus pneumonia, a combination therapy of third or fourth generation cephalosporin, ceftriaxone, cefotaxime, cefepime, and vancomycin plus acyclovir is given as empirical therapy. Specific antimicrobial treatment, as given in the figure, in meningitis caused by Streptococcus pneumonia, which is sensitive to penicillin, the treatment plan includes penicillin G or ceftriaxone or cefotaxime for 10 to 14 days. For Streptococcus pneumonia not sensitive to penicillin and sensitive to ceftriaxone or cefotaxime, ceftriaxone or ceftriaxone is given for same duration. For S. pneumonia, which is not sensitive to penicillin and intermediate sensitive to ceftriaxone or cefotaxime, the treatment plan includes vancomycin plus ceftriaxone or cefotaxime. Consider adding rifampicin if there is no clinical improvement. For Streptococcus pneumonia not sensitive to penicillin and resistant to ceftriaxone or cefotaxime, vancomycin, ceftriaxone or cefotaxime plus rifampicin is given. You can pause the video and read the full treatment plan. Thank you.